Everybody. I was thinking as I was walking up here, I wish my name were Viana, or maybe Woltering. When I moved to Mount Vernon in Washington State 35 years ago to set up a family practice, I was the fifth Dr. Johnson in a town of 12,000 people. One of the doctors, Johnson, was my partner, but he wasn't my brother. One of them was my brother, but he wasn't my partner. And the other two Dr. Johnsons were both brothers and partners. So that's why I became known in Mount Vernon as Dr. Paul. So, okay, well, you've all just heard Dr. Viana talk about multivisceral transplants. And I'm here to tell you the real story now. From the other side of the bed rail. And from a patient's perspective. Let's see. So it's like Gloria Steinem said, all that quote from the Bible, and you shall know the truth and the truth will set you free. Well, she said, the truth will set you free, but first it'll piss you off. So I'm sure you've noticed on your schedules that I have an MD after my name. And but today I'm going to change that from MD to PNET, patient, because today I'm one of you. I'm talking to you as a fellow patient, a neuroendocrine patient, not as a physician. So 4 years ago on a Monday morning, I received a phone call from my family physician with some life-changing and really devastating news. I bet many of you have received phone calls like this. The intermittent abdominal pain that I had been suffering for a number of years was not due to functional bowel syndrome, like I had been told. My doctor said, Paul, you have a mass in your pancreas and multiple spots in your liver. Remember yesterday when Dr. Wang showed us that reversed pyramid? That was me. I had a 1.2 centimeter mass in my pancreas, very tiny, but my liver was full of tumor. Any of you received news like that? Well, as you can imagine, that made a lot of changes in my life. So, for the last 10 years, I have been the medical director of Hospice of the Northwest, and I practice palliative medicine. You know what palliative medicine is? Yeah, it's when people don't have a curable disease, but yet you want to make their quality of life better. My patients have heart failure. We try and make them breathe easier. They have emphysema. We work with them to make their quality of life better. We have neurodegenerative diseases like Parkinson's disease and multiple sclerosis and ALS. About half of my patients have cancer. So I have given bad news like that I received to multiple patients. But nothing, no amount of doctoring and giving bad news like this to prepare you for hearing this kind of news for yourself or for becoming a patient yourself. It's a really scary road, I've discovered. So, well, as you can imagine, getting news like that set into motion a lot of things. The first thing, Kim and I had a very lengthy cry. And then we started doing a lot of scans and biopsies and blood tests. You remember all those? So I had several visits to oncologists, and I started estate planning, and I changed my will. I revised my advance directives, and I shed many tears with colleagues, friends, family members as they heard my very unfortunate news. The one bright spot in this whole dark time came about a week later when I was told that my cell type was not the typical type of pancreatic cancer. You know, most cells that cause pancreatic cancer are adenocarcinoma. I was told mine was a neuroendocrine tumor. Well, that was a big relief because I had taken care of a lot of patients with pancreatic cancer, and I think every one of them died, and usually in a very short order. So, but I had the same kind of tumor that Steve Jobs had, and he'd lived with his tumor for a number of years. So, okay, so my path of discovery eventually took me to New Orleans. There he is over there, and I met a very convivial oncological surgeon named Woltering. And, you know, for those of you who don't know him, he's very convincing in what he tells you you should do. And he's very self-assured. And he knew exactly what I should do. He said, Paul, you need to do 3 things. You need to be on high-dose octreotide. You need to start chemotherapy. And you and Kim need to move to Indianapolis and get on the transplant list for a multivisceral transplant. Well, I just about fell off the exam table. So, after a very frenetic and intense level of activity for a few weeks, Kim and I found ourselves 2,500 miles from home in Indianapolis, Indiana, on the transplant list, waiting for a multivisceral transplant. So, how life can change so quickly. So we started the arduous task of waiting, which is very difficult that far away from home and from all the people you love. But as often I've discovered in life, there's often a silver lining in those dark clouds. We met so many wonderful people in Indianapolis. We made a lot of friends. There were other patients that were waiting for transplant, and we quickly became comrades in a common cause. And then we spent endless hours, Kim and I, at Starbucks with our brand new iPhones. Steve Jobs would have been proud of us for buying Apple. So, and we learned how to use those phones, and then Kim and I just talked. We just had a great time getting to know each other even better than we had, even though we've been together for a lot of years. So we had real mixed emotions about that time. But we became very bonded in this cause. So I still received my bi-weekly injections of octreotide. How many of you have had octreotide injections? Well, you know that needle? You know, it feels that long and about that big around. So I got those injections every 2 weeks in the surgery clinic, and the nurse that always gave it to me was my favorite nurse down there, and her name was Karma Wilson. And as she sat poised with this needle pointed at my hindquarter, I would ask her, so, is this a good karma or a bad karma day? So, while I watched propofol flow into my vein as I lay on that operating table, I never felt so out of control in my life. It was 4 months almost to the day since we had arrived in Indianapolis. And I was filled with anticipation and apprehension. So the next moment, it seemed, I awoke in the cacophony and mayhem that is the ICU at Indiana University. So I couldn't talk because I had a tube down my throat, and I was connected to multiple other tubes and wires. As a physician, I really felt that I had awakened on the wrong side of the bed rail. So Dr. Viana came in later that day and told me that during the 8-hour surgery, he knows me inside and out, by the way, he had replaced my liver and pancreas, my small intestine, and my stomach. A complete multivisceral transplant. So, okay, after 19 days in the hospital, well, Kim spent those 19 days in the hospital too. And she was always by my side. Those were long, sleepless, and very uncomfortable days frequently. But you know, I always focused on recovery and what life could be like again. So, someone who was always in the room emptying this or filling that, balancing my immunosuppressant medications, slowly introducing foods into my new system, and teaching ileostomy care. It was interesting for me to hear that you're doing these now without an ileostomy at times. But I had an ileostomy because they used to take a scope and look in it to see how my intestine was doing to make sure that there was no sign of rejection or infection or that the blood supply was adequate. And I had that ileostomy for about 3 months. So, you know, Kim rubbed my aching back for hours. It was the one thing that seemed to relieve that. That's where most of my pain was centered. And she washed my feet every day because I couldn't reach them myself. I had too many stitches and too many tubes. So, but I can tell you words cannot express how it felt to say goodbye to that plastic-covered hospital mattress. And also those endlessly alarming IV pumps. They went off all the time. Kim and I lived in our little apartment for about 3 more months as I slowly regained some of my strength. There were weekly visits to the surgery clinic where they, you know, made sure I was doing fine, looked at my immunosuppressant drug level, often did another endoscopy to look at my intestine. I became toxic on those immunosuppressant drugs a couple of times, you know, when your absorption is tenuous at times, and I can tell you those were unpleasant feelings. But 3 months after my surgery, my ileostomy was reversed. And you know, having that ileostomy for 3 months has really given me an amazing appreciation for the people and empathy for them and what they live with permanent ileostomies, some people. So it felt strangely uncomfortable and a little bit surreal as we finally headed westward out of Indianapolis 4 months after my surgery. We had been there for 8 months. 2 months later, after getting home, I went snow skiing for the first time. And a month later, I went back to work as the medical director for hospice. So I had been on medical leave for 14 months. Okay, so what's it been like to live with a multivisceral transplant? I can eat anything I want, and I do. I had a full breakfast this morning. I get hungry, and I get thirsty, and I feel sated, and I also feel quenched. You know, all those sensations are not through the vagus nerve that has been cut. They're through the hormonal things, and so it all feels the same. My vagus nerve was cut, and also my ileocecal valve, we heard about that yesterday, was removed because the right side of the colon has to be removed because of blood supply issues. And without them, my intestines sort of decide what to do by themselves. They're not connected to my brain anymore. And so I usually have 2 to 4 bowel movements a day. And I like to be near a bathroom for about an hour after I eat, because that's often when my intestines give me a message. But I was just thinking, I have a lot of patients that I take care of with intractable constipation. And I've actually removed manually fecal impactions. And I got to tell you, I would much rather be the way I am than the way they are. So it's not so bad. I have blood tests every few weeks to make sure that all is functioning well and my immunosuppressant drugs are well balanced. Once a year, I travel to see Dr. Viana in Miami and have a colonoscopy to make sure there's no sign of infection or rejection or anything else. Just once a year. My general quality of life I consider excellent. I do just about everything that I did before my surgery, and including lots of hiking and snow skiing and biking. So as I reflect back on the last several years, my neuroendocrine tumor seems to be on a 3-year cycle. Have you all figured out what your cycle is? I had symptoms for about 3 years before odd, vague, funny symptoms. And then I developed my first abdominal pain when Kim and I were on a trip to Michigan. And I had these pains for about 3 years before finally it was diagnosed that I had this tumor with liver metastases. So I had a multivisceral transplant. And 3 years later, my biomarkers started going up, and it was discovered I had some bony metastases. That's right, the tumors come back again, and it seems like I'm in another 3-year cycle. So I am currently waiting now to do another treatment. And in 1 week, I'm going to be in Switzerland, in Basel, Switzerland, where I'm going to have PRRT. And I'm hoping that this treatment will give me another 3-year cycle, or maybe more, as they develop other treatments for this tumor. So, okay, well, Dr. Viana told you that, his recurrence rates. I am one of those recurrences. But I want you to know that this multivisceral transplant gave me 3 years when I thought, you know what, I might be cured. It gave me 3 years for other treatments to be developed. And am I glad I had the surgery? And the answer would have to be yes, I am. So when Dr. Woltering told me to go get a transplant, he made the comment, we have to reset your biological clock. And he was quite sure, I think, that my tumor would recur because of my cell type and the aggressiveness of the cells. And I think that if I had not had this surgery, I probably wouldn't be alive today, almost certainly. So I'm very grateful that I did get this treatment, my biological clock was reset. So folks, I've got to tell you, a cure's coming. If I had contracted this tumor 15 years sooner, these treatments would not have been available, and I don't think I'd be alive today. So it seems like the goal is to reset that biological clock and keep it up until we have a universal cure that is universally available. Okay, well, a picture's worth 1,000 words. So here's Indianapolis. This is a view from our hotel room. And you can maybe use a little pointer, but this is sort of Hospital Row right here. There's the county hospital, and they're building a new VA hospital. And then the university hospital was over there. So, we arrived in January, and it was very bleak, and actually it was snowing when we got there. Had a horrible ice storm, but I have to tell you, Indianapolis is really beautiful in the spring. And downtown Indianapolis is lovely with the Capitol building. And it just became green and alive. Kim and I quickly found our favorite breakfast place, Mamma Mia's. And this waitress never gave us any trouble. And we didn't have to tip her much either. So we developed instant friends in Indianapolis. Larry and Patsy were from Alabama. Larry had a PNET also. He was awaiting for a multivisceral transplant. As you can see, we're about the same size. And the two things that determine eligibility when organs become available, whether they will work for you, are your size has to match your donor's size, roughly. And then you have to have the same blood type. So Larry and I were the same size. We were waiting for the same surgery. But the good news is that we were in not competition with each other because we had different blood types. So we could become really quickly good friends. So Kim and I went to the air show in Indianapolis. We kept very busy doing lots of fun things. My son and my daughter came to visit. You can see downtown Indianapolis, and boy, have they revitalized that city. This is a big courtyard form that goes all the way down across the White River into downtown Indianapolis. You can see in the background the Marriott Hotel. Just past that is Lucas Oil Stadium, where the Super Bowl was, 2-3 years ago. So my son and I quickly found a pub that we could occasionally frequent. Kim's daughter, Abby, came to visit us with her husband, Tom. We had a lot of fun goofing around with them. So hear no evil, speak no evil, but you can see Abby in the middle with her, she's peeking through her fingers. She still wants to see the evil, whatever it was. So, okay, there I am. That's the ICU in Indianapolis University Hospital. Look at all of the stuff there. Can you imagine that? I can't think there was an orifice in my body that didn't have a tube coming out of it. And I don't know how these nurses can ever keep all that stuff straight. It makes you appreciate how there are mistakes done in hospitals when you have this complicated of post-operative care. This is the day after surgery, and they got me out of bed and up and walking. Everybody applauded as I walked down the hall. So there's my daughter that came to visit me, and there's another good picture of all of the stuff that was going into me, and down below me, things that were coming out of me. I actually sort of have a smile on my face. I'm kind of surprised. Well, you can see one of the best days in my life was 8 days after surgery, and Dr. Viana came by one morning and said, "I don't think you want that in your nose anymore." And he pulled my NG tube out. That was the biggest relief I think I've ever felt in my life. And it was maybe just a couple days after that that Kim brought me a Starbucks. So that was wonderful, maybe the best. But, and you know, they encouraged us to get up and walk all the time. The more you're out of bed, I think the better post-operative surgical patients do. I look at that clock and it's 3:30, and it was probably 3:30 in the morning. It's amazing how I would wake up and just need to go for a walk. Kim would help me get the mobile IV pole ready, and off we would go. And that would relieve that backache for a little while. But I'd have my Starbucks cup. Okay, here's 19 days later. Look at no tubes. And I'm pointing to the pickup. Kim brought the car over and picked me up. Back we went to our hotel. So there's another cup of Starbucks, and look at this smile on my face. I know. Well, and the days went by. We'd actually take our breakfast down to the local Starbucks. You know, spring in Indianapolis is just beautiful. The temperatures are so nice. It's so green. But soon we were going to Huddles for frozen yogurt. And you know, it was not too long before I was eating this stuff. Some friends invited us over, and this is what they served. And Kim's daughter, Amy, and her granddaughters that we came to visit. And you see the little family resemblance there. We took Zoe to the Indianapolis Children's Museum, and Amy told us that we needed to kiss her grits. So my son and I think he came 3 times while we were there. And while we were recovering, we went to the Indianapolis State Fair. We were there the day before that big windstorm blew through Indianapolis and knocked down the stage, killed 6 people. We were there the day before that. Indianapolis has the International Drum and Bugle Corps competitions every year. Boy, that was fun to see, and it goes on for days. Downtown Indianapolis is just phenomenal. They have these canals that you can walk along, and they're just beautiful. So my daughter and my grandson came to visit. Great recreational opportunity on these canals. But you know, finally it was 4 months post-op, and we decided to go home with Dr. Viana's blessing. We packed up everything we had in that little 650 square foot, 1-bedroom apartment, gave away a whole bunch of stuff that we had accumulated for 8 months. And look at our smiles. We're heading west. We packed up our car, and anything we couldn't fit in there, we gave away to the local shelter. I left a little tunnel so I could see out of the rearview mirror. We went through St. Louis, went up in the arch, and you get a great view of that beautiful city. And you know, my favorite place on earth is, well, no, that's actually Kim's favorite place on earth. We went a couple of days across the Midwest, and we did not find a Starbucks, but we finally found one in, I don't know, was this Western Kansas, I think, wasn't it, Kim? But my favorite place, after going to Starbucks, is Yellowstone National Park. How many of you have been there? Well, if you haven't made it, you got to go. It's the best place on earth. And one of my mottos my kids will tell you is, life's too short not to go to Yellowstone every year. So we altered our route to go right through Yellowstone Park, and of course went to Old Faithful and looked at all these big geysers and steaming hot pots. And there I am, 4 months after surgery. And you're up at a mile high, 6,000 feet in Yellowstone, and the air's thinner up there. And, my blood count was still recovering. So Kim and I went out for some walks and very short hikes, but I didn't have yet the energy that I usually have for that sort of stuff. But it was just delightful being there, looking at the Grand Canyon of the Yellowstone. But finally we came down the hill into the valley where Big Lake is located, and there's our house. We hadn't seen it for 8 months, and it was still intact. So, it was not long before we were out hiking. We did a quick trip down to Arizona. This is the Pacific Northwest. Have any of you been to the San Juan Islands? Yeah, that's where we live, really. Mount Vernon is right on the edge of the San Juan Islands, and the hospice region that I take care of includes the San Juan Islands. I go out there all the time. Here, Kim and I borrowed our friend's dog and hiked up on an island called Guaymas Island. Can you see in the background a mountain, a peak, right beside Kim's head there? That's Mount Baker. That's where we go snow skiing. So this is about 6 months post-op. I went snow skiing for the first time. A year after that, Kim and I did a trip to Miami, or down to Florida and the Outer Banks. Spent some time on the beach on our way up to Indianapolis for our follow-up colonoscopy. But my favorite things to do are be with the people I love. Here we are out on Big Lake, and my grandson is learning how to drive our boat. And there's a philosopher, a German philosopher, his name is Goethe. You know him? And he said, things that matter the least should never be subject to the things that matter the most. So take the time for the things that matter the most. Some of the things I've learned through this journey. So get out there and do some hiking. Enjoy this wonderful planet that we live on. Here is sunrise over Big Lake where we live. Well, thanks for listening. You're a wonderful audience.